There are several things about Black history we were never to until now, and one of which is the black human guinea pigs. Slavery was a dehumanizing institution in which people were regarded as commodities and denied their fundamental freedoms. What is less well known, however, is the widespread use of medical experimentation on slaves without their permission, which frequently resulted in great pain and even death. It's shocking to consider that enslaved people's labor was essential to the development of modern medicine, but this is the unfortunate reality. Slave owners and doctors often conducted experiments on slaves without regard for their health or human rights, from the 18th through the middle of the 19th century. The goal of these tests, which included anything from surgical procedures to vaccination trials, was to further medical knowledge for the benefit of white civilization. Tens of thousands of slaves were reportedly used in medical experiments, with many of them dying as a result. And this is one of the shocking revelations about Black history we were never to until now. According to one study, the average longevity of a slave who participated in medical experiments was only 5 years. The wickedness, however, does not stop there. Slaves' bodies were frequently exploited in experiments without regard for their agony or suffering, further dehumanizing them and turning them into mindless objects. The cultural standards of the time are a necessary lens through which to view this issue in all its significance. Slave bodies were frequently utilized for medical experiments in the 19th century because slaves were treated more like objects than humans. The use of pregnant slaves as surgical guinea pigs is one of the most horrifying examples of this. Dr. J. Marion Sims, widely regarded as the pioneer of contemporary gynecology, conducted a series of groundbreaking surgical experiments on enslaved women in Alabama in the middle of the 19th century. These women helped Sims hone his surgical procedures for treating vesicovaginal fistulas, a disorder that causes urine to seep from the bladder into the vagina and can occur during childbirth. Sims subjected these ladies to repeated procedures, frequently without anesthesia, and meticulously documented their anguish. Even more alarming is Sims's assumption that Black women had a normal pain threshold, and her habit of ignoring their cries of agony as a result of these procedures. A woman solely identified as Anarcha underwent almost 30 separate operations by Sims, all of which were conducted without anesthesia or painkillers. In addition, he conducted tests on a new mother named Lucy, who had recently given birth but had been experiencing bladder control issues ever since. Patients were asked to disrobe to the waist and lay their heads on their hands during the operation, which required them to kneel on the floor. Lucy was operated on for an hour as nearly a dozen other doctors looked on. Lucy was in terrible pain, as Sims noted in his book. She developed blood poisoning when he controversially used a sponge to divert urine away from her bladder, and she quickly deteriorated. He estimated that it would take Lucy around 3 months to fully recuperate from the surgery. Over the course of many years, Sims conducted experiments on enslaved women, and finally used what he learned to perform comparable surgery on white women. However, Sims was not alone in conducting medical experiments on slaves. In their pursuit of medical knowledge, other doctors like Dr. Walter F. Jones and Dr. Robert Marion also operated on pregnant slaves and male slaves. In the middle of the 19th century, Dr. Walter F. Jones was an Alabama-based physician and medical researcher. In 1844, he became the penitentiary's official physician and immediately began testing his theories on the inmates. However, he quickly expanded his studies to include slaves, whom he bought with the intention of utilizing them as test subjects. Jones used his captive subjects for a variety of experiments, including surgery and injections. He said he was researching treatments for TB and pneumonia by trying out experimental surgical procedures, but his techniques were frequently cruel, resulting in untold misery for the slaves. Jones's excision of a slave woman's uterus without anesthesia ranks among his most controversial experiments. Other slaves were made to watch as the operation was carried out. The woman did not have uterine cancer, but Jones said he was testing a novel surgical procedure for treating it. Slaves of Jones's were also given injections of various drugs and poisons, including morphine and arsenic. A huge amount of strychnine, a poison that induces muscle convulsions and death, was injected into a slave as part of one experiment. The dying guy endured agony for several hours. The tests conducted by Jones were not only brutal and barbaric, but also totally unethical. He neglected to give his test participants proper medical attention following the studies, and did not have their informed permission. A significant number of the slaves who participated in these experiments either passed away or were rendered permanently unable to work and disfigured as a result of their ordeal. One more illustration is provided by Dr. Robert Marion. Marion, a physician from South Carolina, rose to popularity for his experiments that he carried out on slaves. He conducted experiments on people who were kept as slaves so that he could gain more knowledge about diseases such as typhoid fever, yellow fever, and smallpox. Marion believed that if he studied the anatomy of slaves, he could gain a better understanding of the human body as a whole. One of the most infamous experiments that Marion ever carried out was the vaccination of slaves with the disease that causes smallpox. In the latter half of the 18th century, smallpox was a widespread pandemic that was responsible for the deaths of tens of thousands of people each year. Marion believed that by infecting his slaves with smallpox, he would be able to get more knowledge about the disease and possibly even develop a vaccine for it. In the year 1796, Marion gave a vaccination against smallpox to a slave named Onesimus. The fact that Onesimus was able to beat the disease demonstrates that the experiment was a success. Despite this, Marion continued to conduct experiments on her slaves, which usually resulted in their deaths. He utilized the blood of a slave woman whom he had previously infected with smallpox in order to ward off the sickness in other individuals. As a consequence of the experiment, the slave subjects all passed away. Slave individuals who participated in Marion's research stated that they experienced considerable psychological distress. A good number of them were subjected to unpleasant and frequently hazardous operations that were performed on them without their knowledge or consent. They were not shown any degree of respect since the scientific community chose to overlook their humanity in favor of their curiosity. Not everyone shared Marion's interest in the smallpox virus. Virginia Dr. John Quire decided to buy the pig Onesimus in an effort to gain insight into the inoculation procedure. Quire was curious about Onesimus's smallpox immunity, so he launched a series of tests on him. He deliberately exposed Onesimus to the smallpox virus and recorded his reactions. He also immunized his own family members and several other slaves in his care. Dr. Samuel Cartwright is another famous name associated with the practice of conducting medical experiments on slaves. In the middle 1800s in Louisiana, where Cartwright practiced medicine, he also owned a plantation. Most notably, he proposed the concept of drapetomania, a mental disorder he said afflicted slaves who attempted to flee their masters. It is revealed that from the 18th to the mid-19th century, slave owners and doctors regularly experimented on enslaved individuals without their consent, resulting in immense suffering and even death. Do not forget to subscribe for more thrilling Black history content. The experiments ranged from vaccination trials to surgical procedures, all in the pursuit of advancing medical knowledge for the benefit of white society. One example highlighted is Dr. J. Marion Sims, known as the father of modern gynecology, who performed numerous experimental surgeries on enslaved women without anesthesia, believing that Black women were immune to pain. Another doctor, Dr. Walter F. Jones, conducted experiments on enslaved pregnant women and enslaved men, claiming to be testing new surgical techniques and seeking cures for diseases such as tuberculosis and pneumonia. These examples shed light on the dark history of using enslaved people as objects for medical experimentation and the long-lasting impact it has had on African Americans' access to health care and medical discrimination. The infamous Tuskegee syphilis study, conducted from 1932 to 1972, involved 600 Black men who were not informed about their syphilis condition or given proper treatment. Similarly, Henrietta Lacks's cancer cells were taken without consent, leading to medical research without her family's knowledge. These instances of unethical experimentation and lack of consent perpetuate systemic racism in the medical field, eroding trust within the Black African American community and posing serious public health implications. The misuse of enslaved individuals and the lack of regard for their lives and well-being highlight a pattern of systemic racism in medical research. It is crucial to address and rectify these injustices for a more equitable society. Shocking discoveries leaves many stunned. Click on the next video to find out more.